Dr. Adam Fazio. I'm a board-certified urologic surgeon. I founded a clinic in Miami called Miami Men's. I think what's really sort of distinct about what we've done at Miami Men's is that we've created a really complete center for male sexual health and wellness. The cornerstone of the center really is the Himplant. That's really what started it all. And from there, we realized that we wanted to offer guys more services just beyond penile enlargement or penile augmentation. So we do cosmetic urology in general. And beyond that, we offer sexual health services, so erectile dysfunction, weight loss, plastic surgery. So it's a place really designed for men to feel comfortable, sort of coming forward with their general sort of cosmetic needs. A place where that they know we have a sort of a man in mind, and that we can really offer them a full spectrum of whatever they may want. Yeah, penis enlargement's real. It really does work. I think a lot of guys have been bombarded with ads online for clearly illegitimate procedures and treatments, and so a lot of guys come to the table with a lot of doubts, but it is real. Right? But it depends really on what modality, what treatment you ultimately choose. For me, implant is the gold standard. A subcutaneous silicone implant gives guys increased girth and increased length when they're soft, and when they're hard, it's going to give them increased girth and overall increased size. Right? Nothing's going to increase your erect length, but we can increase penile size overall. And implant does an absolutely excellent job of doing that, and that's why I see it as the gold standard. There are other options out there, like fillers. For example, if we're talking about hyaluronic acid, it will make a guy thicker for sure, right? It'll make you thicker, but not in a way that appears natural. It's going to give a guy this sort of ballooned out shape that doesn't appear natural. And it's not really functional either. Having this constantly soft sort of form around your penis is not something that's going to let a guy actually use this in any sort of meaningful way. So it's really important to think about, well, what modality is going to work for a guy, but there are modalities like the implant that are absolutely effective. Yeah, so I've been working with Himplant for 2 years now. And when I initially started, I came out here, I met my mentor, Dr. Ellis, and I began to train under him, really trying to gain knowledge from his 20 years of experience with Himplant, his 20 years of design changes, and 20 years of really figuring out how to make this the best procedure you possibly can. Once I felt ready to take the next step, we opened up our clinic in Miami Men's, and we started our program there. Over the past 2 years, we really hit our stride. We figured out really not only how to perform the procedure at really a top level, but also to provide all the services that come along with the procedure and make sure our patients are really walked from the day they call me on the phone to the day of surgery and through those 8 weeks of recovery. So we have a system that's really patient-focused, that's really built to get guys through the whole process without any hiccups, and I think that's what's really unique about our center. I'm in Florida and Miami, so we have guys primarily from the southeast of the US, but we get people from all over the world. We had a guy come from Melbourne, Australia a few weeks ago. We get a lot of people from Latin America and a lot of Europeans as well. And so obviously I can't see those patients in person beforehand, so most of those guys will set up Zoom calls, or we'll do a WhatsApp call and really walk them through the whole process. So just to give you a sense of how that process works, we're going to take you through the whole consultation steps, and where I really evaluate a patient, talk to him about the procedure, and make sure he's an ideal candidate for it. When I do a consultation, it's really a two-way interview. I want the guys to get to know me. I want to gain their trust. I want them to make sure I'm the guy that they'll feel comfortable with, right? Going through this whole process. For me, what I'm really trying to figure out is, one, is the guy a good medical candidate? Does he have any contraindications to the procedure? Is he someone who's going to be able to undergo the procedure without any medical issues? Aside from that, I want to make sure he has the right mindset, right? That he's doing this for the right reasons. And the first question I always ask a patient is, why do you want to do this? What are your motivations? What are your objectives in the end? Because if I can't reach those objectives, so I can't help a guy get there, I'm not going to offer the surgery. I'm setting myself up for failure. I'm setting him up for failure. So the first and most important question is, why do you want to do this, right? And the magic word or the magic words are typically somewhere around self-confidence, about feeling good about yourself. In some cases where someone's in sort of a committed relationship and they've really navigated this with their partner, about having fun, about sexual pleasure. Right? When I have a couple who sort of makes this group decision of saying, we know what we like, we know this is what's going to make our sex life better, let's do it, I think that's amazing. So those are really the first questions I have to ask. What I'm trying to avoid, right, is the situation where someone is trying to surprise a partner. Like we've all seen that before. Or someone's trying to win back a partner. I can't guarantee those results. And I'm not going to help a guy, or I'm not going to have a guy go through this whole process for something that is likely to fail. So that's the first starting point of any interaction, is figuring out, well, what are your goals and can Himplant help you get there? Once we've sort of established a guy's expectations, we talk about what the Himplant can and can't do. It's always key to make sure that guys understand that this is going to add girth, right? 1 to 2 inches in the flaccid state. So in terms of circumference, it's going to pull guys out closer to their erect length when they're soft. Not all the way there, but it's really going to let them hang out longer. So a guy who says, I'm a grower, but when I'm soft, I'm just embarrassed by what I have. I wish I could really exhibit or show off what I have. I know I have in the bedroom when I'm turned on. So for those guys who can sort of be pulled out longer and thicker, they're really happy with the Himplant. This is sort of an ideal procedure for them. We talk about the fact that when they get an erection, right, it's going to open up around their erection, make them even thicker at that point. The key, though, is establishing that this is not going to make them any longer in the erect state. As someone who's focused on erectile length, this probably isn't the procedure for them. And there's really no procedure for them. If we're being honest and we're evaluating what else is out there, nothing is going to increase your erect length other than losing a little fat by the base of the pubic bone. So once a guy has good motivation, understands the procedure, understands what it can and can't do for them, we go through all their medical background to make sure there are no contraindications. Talk about, are you a smoker? Are you a poorly controlled diabetic? What's your body type like? So a guy who carries a lot of fat in the belly or a lot of suprapubic fat, they tend not to be great candidates because the base of the implant is sort of going to swim around in that fat. It's going to flatten out. They're going to have a higher risk of seromas. Those are guys who are probably not going to be happy with the procedure unless we take some steps beforehand to get them in shape for the procedure. A lot of guys go on weight loss regimens. Well, some people do lipo. Well, some guys do abdominoplasty. Some people require a few setups to make sure that this goes as well as it possibly can. I always like to walk guys through the actual surgery and explain to them how this works. I think it's good for them to have just a basic concept of what we're going to be doing. So I tell my guys, we bring them to a surgery center. I only work with board-certified anesthesiologists. We don't work with CRNAs because I really want to trust the person on the other side of the drape. I want to know I'm with someone who can control my patient and get them through the surgery safely. The time of the surgery is really variable. This isn't a race. I mean, it's good to do this in a relatively expeditious fashion, but at the end of the day, it's about the cosmetic outcome. So it could take an hour, it could take an hour and a half. From a patient's perspective, they're asleep. It doesn't really make a difference. For me, if I see something that doesn't look quite right, I'm going to redo it. I'm not going to let my guys walk out of the operating room without something that looks really nice, something I'm proud of, and I think they're going to be proud of as well. So the surgery really begins with a small incision, about this long, on the side of the scrotum. I'm right-handed, so the incision's on the left side of the scrotum. This incision it's really sort of slick the way it's made because it's not going to be visible afterwards. It's on the side, so no one really sees it there. Oftentimes, the way it heals, you'll barely see a little white line, and it's usually going to be hidden in some of the crevices of the scrotum. So we make that incision and we dissect towards the base of the implant, or base of the penis. Create a little pocket to place the implant in. Then we sew in the front end, that's this thinner end here, right behind the head of the penis. So once that's secured, we trim the back end, and that's for each guy. That's sort of a modification we make for each patient. Put the implant in place, drop a surgical drain, sew them up, and they're done. So conceptually, it's pretty straightforward in terms of how we do this. Yeah, so post-operative day 3, we talked about before, that's where I say goodbye to my patients. So that's when my patients typically will leave Miami, and the post-operative period really begins. My patients all are very clear when they leave what those restrictions are going to be for a full 8 weeks. And the goal, and I think it's really important that guys understand what the goals are to limit any sort of complications, right? So the main thing guys are going to avoid, first, is any sort of strenuous activity. We're talking about any sort of cardio activity, so running. You can imagine they have this new, heavier, thicker penis be wagging like a dog's tail. I don't want that happening. It's going to cause inflammation. It's going to cause seroma formation. They're going to avoid that for a full 8 weeks. Sex. You can imagine sex is going to cause friction between the skin and the implant. Cause a few problems. It can cause a seroma formation. It can cause small tears in the skin, which ultimately would lead to a perforation, erosion, and infection. So I think I need to really plant that seed in my guys' minds that you cannot have sex of any sort. It's not to say I don't get calls at 4 weeks or 5 weeks or 6 weeks saying, doc, you'd understand. I've got this opportunity. I really want to deploy it in the field. And I always tell them, no, you got to wait the full 8 weeks because this was a huge commitment. You made a huge investment in yourself. Avoiding sex of all types, including masturbation, for 8 weeks is remarkably important. So 8 weeks with no cardio, 8 weeks without sex of any sort. Some of my colleagues may shift those timelines a little bit, but that's what I tell my patients. Weightlifting. I always ask guys, what do you do for a living? And are you a weightlifter sort of as a general activity? Because it's really important in the early weeks after surgery, they not sort of bear down or lift any weights because it can cause some bleeding in the suprapubic area. So for my guys, I ask them 4 weeks out any weightlifting at all. At 4 weeks, to start doing upper body, 6 weeks lower body. Showers are okay. So after the drain comes out, guys can begin showering. I tell them you could put soapy water in your lower abdomen, let that sort of wash over the penis and scrotum, sort of splash a little bit. I don't want anyone scrubbing, especially early on. So just using your hands and not being very aggressive with your washing. So showers are okay, baths are not okay. So I don't want anyone submerging their incisions underwater for at least 4 to 6 weeks. Beyond that, other things to take care of. I want everyone to really moisturize their penis. So the Urolab we talked about before can sort of chafe, especially if people are going on long walks. So I ask guys just to use any sort of cream or moisturizer they have to keep it moisturized. Have guys elevate their penis at night to help with drainage. And that's really the meat of the whole post-operative recovery. So the Himplant procedure is largely pain-free early on. When I see a patient in my clinic the day after surgery, they're walking around, they're not grimacing, they're not complaining of any pain. At most, guys are managing their discomfort with Tylenol or ibuprofen. So I think that really speaks a lot to the level of discomfort immediately after surgery. In the few first days after surgery, some guys will note that their drainage tube is nagging them a bit. It's a little uncomfortable. Let's say they have a bit of an ache by the pubic bone, but is not the type of pain that people are expecting from other sort of cosmetic procedures. A lot of my patients have seen their wives go through breast augmentation or BBLs, which can be remarkably painful, and that's not what we're dealing with here at all. I think the most common complaint in the 8 weeks after surgery we get from patients are nocturnal erections. They can be intense, they can be relatively painful, but they are short-lived. I'll have all my guys hop out of bed, take a walk around the room, and we usually can knock down those erections. Yeah, so I'll check in with my guys in a formal fashion every 2 weeks, but people will check in with us intermittently with additional questions. 8 week is really the mark that everyone's looking forward to. That's when you're sort of allowed to resume a lot of the activities you've been missing out on, and most importantly, sex. When guys start a sexual activity, I don't want them immediately going hard. Right? I tell everyone for a few times, try to masturbate. Use a lot of lube. Baby steps into oral sex and eventually into intercourse using a lot of lube, using condoms. And the goal here is really to reduce friction on that skin until we are 100% healed. And that point's not so perfectly defined. So I think taking cautions or precautions in those early weeks until your partner's used to sort of the new you, until your partner is able to accommodate the new version of you is really important. I think for a lot of patients, when they're initially looking for a surgeon, their first step is to look for the guy who's closest to them. And this isn't always the best way of approaching a surgery like implant surgery. I think we need to step back and consider the fact that your penis is probably one of your most valuable assets that you have in this world. And you really need to find a place that's going to, one, give you a good outcome, a place you could trust, and someone you really think is going to take care of you throughout the whole process. And one of the real distinguishing factors between implant and some of the non-invasive modalities like filler is really selective in terms of who they allow to do the procedure. Right? They've only selected a small group of guys who are experts in reconstructive urology, experts in sexual medicine, guys who have trained through the implant process in terms of how to do this procedure appropriately. Med spas have popped up all over the country, staffed by non-surgeons, non-urologists, and oftentimes non-physicians, offering less invasive modalities for penile enhancement. So here we're really talking about fillers and occasionally fat grafting and other modalities. Going back to the point that your penis really is one of your most valued assets, I want everyone to think about do you really want to trust that asset with a non-physician, with a surgeon who's not trained in penile surgery? Is this really the way you want to go? So not only thinking about who's going to be doing the procedure, but the nature of the procedure. Now, you owe yourself the gold standard, right? There's no reason to compromise with your penis. When you have one shot to really get a good outcome with any sort of penile enhancement procedure, really step back and think about what's the gold standard, who's the appropriate person to be doing it. Make your choice based on those pieces of information and not just on what appears to be convenient. My location is in Miami, Florida, so most of our patients will come from the southeast of the US. However, we get guys from all over the globe. We have guys from Australia, a lot of patients from Latin America, a lot of patients from Europe. One of the benefits of being in Miami and being in a Spanish-speaking city is that we can accommodate all of our patients from Latin America. We can accommodate patients from Spain and Italy, and make this a really comfortable process where they are fully informed, where they're not going through, translators and interpreters, where they can interact with our staff. So we're set up to not only face the southeast of the US, but really much the globe in terms of helping guys get this procedure done. In order to learn more about our centers of excellence, you can go to himplant.com and see where all of our providers are currently located and find a provider and a location that works for you. So thanks for joining us today. I'm Dr. Adam Fazio. Please subscribe to our channel if you like this video and want to see more similar content. If you have any comments or questions, please leave them in the comment section below.